Hi, my name is Dr. Alan O'Reilly and I am a GP and lactation consultant working in Dublin. I have been performing tongue tie releases for over 10 years now, and I just want to talk you through where my clinics are located and what's involved when you visit the clinic. Okay, so I have two clinics. One is in Dublin city centre in the Portobello area at the Meath Primary Care Centre. There is plenty of off-street parking here. My other clinic is in Dermot Cabinet Orthodontics in Foxrock, and there is parking on site here. Okay. The Foxrock Clinic is located about 5 minutes from the M50, so it's pretty accessible for those that don't fancy the city centre. So at the consultation, we talk through any symptoms you or your baby are experiencing, any concerns you have about the procedure, and your expectations after the procedure. Um, so then I perform an examination where I look at the level of the restriction, the type of restriction, what type of tissue it is. Is it very fibrous or is it very elastic? And we get a good idea of the tongue function from the anatomy. We can learn a lot from that. There are different types of tongue tie. Generally, the anterior ones are more severe and the posterior ones are milder with less symptoms. Um, so there are some risks with the procedure. There's a 1 in 300 chance of a small bleed requiring some pressure down on the tongue for up to 5 to 10 minutes. 1 in 100,000 chance you would need to go to hospital to have the bleeding controlled, and 1 in 10,000 risk of infection. It's important to let us know if there's any family history of any bleeding disorders, hemophilia or Van Willebrand's, or if your child has not received vitamin K injection. So the procedure itself, your baby is simply swaddled in a blanket. We apply some topical local anesthetic and then perform the procedure. Um, it's not as bad as it sounds. Generally, I've honestly had some babies sleep through it, very young babies, but generally babies tolerate it quite well. They react for a second. They react when they're being swaddled. They don't want to be swaddled. They'd rather be comfortably in your arms. But we swaddle them, and then the procedure itself, they cry for maybe 1 or 2 minutes afterwards and generally settle when we give them a feed. So I use the strabismus scissors. This is the recommended tool in the current national guidelines. It's fast, precise, and a better recovery time for baby. And in my experience, less inflammation and less scar tissue. I can also use a CO2 laser. Um, this I would reserve for cases where I'm more concerned about a higher risk of bleeding, if the tissue is thicker, or I'm concerned about any blood vessels, as the CO2 laser helps to cauterize any blood vessels. So there can be a little bit more inflammation after the laser, and it appears to be a little bit more tender for some time afterwards, and there appears to be a higher rate of reattachment in my experience. So generally, you're recommending a wound massage for the CO2 laser. So for me, the scissors is the preferred tool as per the current national guidelines. Functional frenuloplasty is another procedure. Um, this is a procedure used, generally recommended for older kids by the Breathe Institute, who developed this procedure, where you're doing physiotherapy before the procedure and afterwards to correct any, we'll say, bad habits that have developed because of the tongue tie. The Breathe Institute, as I say, that developed this procedure, they started on kids generally over 4 or 5 years of age so they can perform the exercises correctly. After the procedure, so a baby is given the breast or bottle, whatever way they've been feeding most recently before the procedure. We want them to simply latch on and relax, and it gives them comfort, and it also helps stop the bleeding. Okay. So that is basically it. So I hope you find all that helpful. Thanks very much.